Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all the support. Thank you. What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound.
The kids, man. We got the kids, man. Last night was my third night of working, and it was my third night down in the ER. I don't work the ER 3 nights in a row, man. Like I told y'all, a lot of people left who work ER, so now it's really on me and 2 other people. And the reason I worked, I picked up an overtime day, Sunday. I was off on Sunday, but I came in. They called me, and it was like, they don't really have anybody to work the ER. Can I please come in and help them? Hey, man, that's the beauty and the benefit of knowing how to work multiple areas. They gonna call you and say, please come get this extra fatty. You feel me? We got it for you. Do you want it? You better believe it. The holidays is around the corner. You feel me? I gotta stay on my grind, because if Jody Jo don't get what she wants, she whine. You feel me? So I gotta keep grinding for little Jody, man. And speaking of grinding for Jody, like, I know last year for Christmas I did like Christmas gift unboxing. If you ain't go see that, check that stuff out. I showed you everything I got for Christmas. The lifestyle was living it, was happy, was blessed, everything all good. But this year, I'm not gonna do that because, like, I know it's like the COVID pandemic. A lot of people out of work. A lot of people not working as much. A lot of people ain't got that kind of fatty. So I don't even want to, like, I don't even want to put that in nobody's face like that. Especially, at least not now, you feel me? Not when people are hurting, you feel me? But some people may want to see it. They may want to see that and get that motivation. But, like, I just can't do it. So instead, what I'm going to do is, the plan is, I'm going to show, like, me giving back. You feel me? I may do, like, a Salvation Army angel or something like that. Or just go get somebody something. But I'm going to show y'all giving back. You feel me? During this time. Like, I'm blessed. I need to, like, realize that everybody, like, not in a good position, you feel me? Like, so, hey, but stay strong as possible. But last night down in the ER, I don't know about my stomach, bro. Like, damn, I ate before work, but then I fell asleep after I ate. And when I got to work, I was like, damn, I'm hungry, man. But I didn't bring any food. All I had is, like, bro, water. People down in the ER, around 4 o'clock in the morning, they got, like, donuts from Dunkin' Donuts. They had donuts. Now, ain't nobody called me for donuts, but they called me for help when they need help. And they see me around, like, 5. Like, it's something an hour later after getting donuts. Oh, we got donuts if you want. We got donuts if you want some. Bro, I'm not gonna eat no food that somebody been, like, picking and planting. Oh, I'm straight, but I'm starving. But I'm straight. I'm telling you, I'm straight. I'm good. But I'm starving, though. But I'm saying I'm straight. I'm good, man, but to start off my shift, they called me down to the ER. They saying they wanted a patient put on BiPAP, treatment, ABG, all this stuff here. I'm like, all right, cool, I'll be down there. Got down, I put on my PPE. I saw the doc. I'm like, all right, doc, which room is the patient that need to be on BiPAP? He's like, yeah, it's this room. I'm like, all right, I'm gonna put the patient on BiPAP, and then I'm gonna get an ABG. Oh, well, I prefer if you get an ABG baseline if you do that first. Man, okay, somebody need to go on BiPAP. We already know that the ABG results is gonna be bad because the patient needs BiPAP. They not ventilating properly. Like, that's something like we can see. So, but since I talked to the doctor and he said he wanted ABG first, I'm gonna go ahead and I'm gonna do that as long as the order is put in. You feel me? Order is put in. I did ABG. It's horrible. Patient on BiPAP, 15 minutes. They want another ABG stat. Now the ABG is good. Like I knew it was gonna be because we on BiPAP. So you know what I'm doing next time, dog? Y'all want ABG? Hey, I got you. You want ABG? I got you. I'm not gonna say I'm gonna put patient on BiPAP and get ABG. No. You want an ABG? No problem, doc. I got you. I'm gonna get you an ABG. Now I ain't say when, but I'm gonna get you one. Cause I'm doing triple work, hurting people. Like, bro, ABG hurts, dog. That artery is surrounded by nerves. That is painful. Now I gotta go do this twice just because somebody want a baseline? Hey, dog. So I'm gonna just do what I gotta do from now on, man. I'm gonna do what I gotta do, dog. Then what else took place? I ain't really like last night. Let me knock on some wood, man. Knock on this wood grain. You feel me? Knock on this wood grain. Like, it hasn't been busy, dog. But I know a time is coming. I know it's gonna be up, bro. Like, it's up, bro. Get ready. Another patient came on BiPAP. Any paramedics out there, man? Like, whenever a paramedic or fire rescue brings in a patient that like needs BiPAP, they always have them on like a CPAP machine. I guess they don't have like a BiPAP, so they just put them on CPAP. So the patient is kind of like still struggling because that's just CPAP. When the BiPAP is more like bringing ventilation in, out, in, out, in, out, in, out. CPAP is just continuous positive airway pressure, just continuous flow. So the BiPAP is much better, you feel me? So I did that, put the patient on BiPAP. Patient came around doing much better. But as we was transporting the patient, I seen this done a lot, bro. A lot of people do this. Take a patient off a BiPAP, you transport them on 100% non-rebreather, then you put them back on BiPAP once you get to the room. If they can tolerate it. Now, if they can't, you just do the BiPAP through the hallway, you try your best. So, patient gets to the room, finna slide the patient over to the bed, disconnect the O2 tank, disconnect the non-rebreather from the O2 tank, but keep the mask on the patient until they get them over to hook it back up. Like, no. You don't want to do that because why would you not want to keep a patient on a non-rebreather that's not hooked up to oxygen? Please drop down in the comments and let me know, man. Why would you not want to do something like that? I'm going to wait, man. Please drop the comment. Please drop the comment. The reason that you don't want to leave a patient on a non-rebreather that's not connected to the FiO2, the flow meter, is because when a non-rebreather is not getting oxygen delivered through it, it's literally like suffocating the patient, making it hard for the patient to breathe because there's no airflow coming through this. It's like you suffocating the patient, bro. So instead of doing that, you better off just taking that mask off and being on 21%, just room air. That's that's better than nothing. That's better than being suffocated. But like, a lot of people just like, I think it's like a nasal cannula or a venti mask, but it's a non-rebreather, so that's different. And I seen this happen. Like, so I seen this happening, so I just went and took the mask off the patient. The patient saying, "Yeah, I'm gonna need some oxygen soon." Cause dog can't breathe. You feel me? But it's like, so respiratory therapy is like, that's common sense. But if somebody who doesn't know how that device really works, doesn't know the old school devices, they may think it's just like a nasal cannula, just like a venti mask. You can leave it on for a second without airflow, it's no problem. But if it's a non-rebreather mask, it is a problem, man. And like, speaking of problems, you feel me? Like, I had problems. I overcame a lot of my problems, you feel me? So when I be like posting stuff to, like, I post pictures to Instagram and like uploading like YouTube videos, and people let me know that, hey man, like, this is motivational. I never look at it as motivational. I never look at it like, I never post a video, I'm finna motivate somebody. Except when I'm talking to like the students, you feel me? I'm trying to motivate the students. That's different. But like, just my normal videos, my normal, like, any post I put on Instagram is never to like motivate somebody. It's just to like keep it real with people. But when somebody says like, hey man, this is motivation, like, bro, I needed this, thank you, it makes me like, I'm like, damn, this is motivational? Then I gotta take back and view it from like somebody else's perspective, not from just me posting something and saying, okay, that's what I posted. So like, when I look at it from like that point of view, like, damn, I can see how this is motivational. Like, I'm telling you I was in a problem, and then I overcame that problem. Now I'm here, and it's all good. So I can see where the motivation can lie. And then it's like, people I like work with in the hospital who like really seen me, like, they seen me like go from like breaking down boxes, transporting people, low income jobs, driving the car to work that was barely like working, shaking and getting outside of work, having to pump up my tire with like the automatic tire pumper from out of my trunk because my tire was flat and I couldn't afford a new tire. Like, they seen this stuff, but now they see me now where I elevated it to. I see how they can see it from a whole different light. Like, nah, this is like for real, for real. And they do like a lot of like reposting me on Instagram, a lot of like sharing my YouTube videos. I appreciate all the supporters. Thank y'all for that. And I see how they can like support it like that, like, and how they can like be motivated by it, because like they seen me. Like, I know, like, I tell y'all the story, I tell y'all what went down, but like they actually seen this stuff like firsthand. You feel me? They seen me like really like, bro, cutting boxes and breaking them down, and now it's just like, so yeah, man. I don't know. I just had to touch on that because like, posted a pic yesterday. A lot of people was like, yeah, that's motivational. People kept like reposting my post. I'm like, damn. I was just saying, this what it is. Like, this how I'm living right now. You feel me? I guess, you know, I'm just doing like what was done for me, dog. Like, I remember the first day I became a respiratory therapist. The first day I got hired as a therapist, and I was on my job being like intern, being like, not intern, but like oriented, being trained for like what I'm be doing. Like, you follow somebody around. The first day, dude I was with was a therapist. He was training me. He was on the phone. He was like, yeah, I want this done. I want that done. I want to have like the 2-car garage. Like, I want to have it like sealed. I'm like, okay, cool. He's like, yeah, man. He hung on the phone. Yeah, I was just on the phone with my contractor that's gonna build my house. I'm like, you got somebody building your house? He's like, yeah, I got a house that's being built. I'm like, damn, how you do that? He's like, you know, you find the area that you want to live in. You pick the lot, and they start to build on it. You tell them what you want in your house as they go along. So I'm thinking like, damn. He working the same job. They don't working. He got enough to get a house and build it from scratch. Motivation. Motivated? Oh, Lord, dog, it's possible. That was motivation for me. Like, damn. Then lo and behold, 4 years later, I'm buying a house that's being built, telling them what I want in it. Like, bro, like it. So I understand. Like, I get it. But when I'm doing it, I'm like just living my life, so I don't really see it like that. But then dog was just living his life on the phone, just yada yada, and then motivated me. He wasn't, you feel me? He wasn't trying to. Dog was talking about some real stuff, and I took it as motivation. So like, I see how it go, man. Like, all you gotta do is, you feel me, just like when it's your turn, you get in that position, somebody looking at you, just give them that same game, that same motivation, that same grind. Like, don't deter nobody or like put nobody down, you feel me? Cause we was all there at one point. So I don't know, man, but yeah, that's what happened last night, dog. That's what I was going through in my head. Like, I had a good night at work, wasn't really too busy, but the overall like picture I had in my head, like the vision, the where I came from with it, where I'm at with it, how people seeing me get it, how they seen me do it, how they motivated to do it. It's like, damn, how I was motivated to do it. That's just how the world works. It's just like a revolving circle, man. You get motivated by somebody, you motivate somebody, then they gonna motivate somebody, they gonna motivate. It just keep going on. It's possible, dog. Just stay with it, man. Don't give up and stay with it, bro. It ain't easy, but it's possible, dog. God real.